Hi, I'm Congresswoman Lori Trahan, and I want to thank you all for tuning in to our discussion series on Being the Change, Conversations with Leaders to Fight to End Racial Injustice. If you tuned in last week, you know that these conversations with experts will focus on how inequality, injustice, and racism affect communities of color and how we must ensure that long overdue action in several areas of public policy is finally taken. This Friday will mark 3 weeks since the House of Representatives passed the George Floyd Justice and Policing Act, a bill which will change the way policing is done in communities across the country. Yet Mitch McConnell continues to refuse to take this legislation up for a vote in the Senate, but it's so important that we recognize that we can't let him stand in the way of progress. This movement is bigger than him. It's bigger than any one of us. And this movement goes far beyond tackling the issue of police brutality and racial profiling. And that's why we have to keep the momentum going. And it's why I'm thrilled to be joined today by my friend and my classmate in the House, Congresswoman Lauren Underwood, for a discussion about the racial disparities that persist in our healthcare system. This is an extremely important issue that has been made worse by the coronavirus pandemic, which has disproportionately affected Black men and women. And these past few months have highlighted what communities of color have known to be true for decades. Disparities in healthcare are deadly. Make no mistake, racism is a public health crisis. And as a community and as a nation, we know we can fix this problem, but we need to start by actually acknowledging that this issue is real and that it continues to persist in every corner of our country. With that, I have to turn it over to Congresswoman Underwood, who proudly represents Illinois' 14th Congressional District. Before coming to Congress, Congresswoman Underwood was a nurse and served as a senior advisor to the US Department of Health and Human Services, where she helped communities across the country prevent and prepare for disasters, bioterror threats, and public health emergencies. We're lucky to have her expertise in the House. And during that time, she's utilized her public health experience to lead on a wide array of healthcare issues affecting not only families in her district, but across the country. Last year, she co-founded the Black Maternal Health Caucus with Congresswoman Alma Adams to address the disparity in maternal mortality rates, where Black women are 3 to 4 times more likely to die from pregnancy-related complications than white women, and are also twice as likely to lose an infant to premature death. Her contributions on this important topic have been pivotal in moving forward the national conversation surrounding Black women's health. Lauren, it's so great to see you. Welcome.
Thanks, Lori. It's so good to be with you.
So I have to kick it off with the question. I want our audience to know your inspiring story. You've been talking about racial inequality and injustice for a long time. And frankly, right now, there are a lot of people, young and old, who are wondering, what path do I take to make a difference in my community? So how about you sharing with us how you decided your path?
Well, thanks for that question. I had to think back, and when I was in elementary school, I grew up in the community that I live in now. It's a town called Naperville. It's 45 minutes west of Chicago. At that time, it was like a farming community that was just beginning to transition to the vibrant suburban environment that we are right now. And I was a very active kid. And one day I was in a swim lesson. And I was anxious because that day we had to learn how to tread water, and I was scared and got a little bit hysterical in the pool, and my heart started racing, and it just never slowed down. I ended up getting pulled out to the pool, gone to my doctor's office, off to the emergency department, and ultimately got diagnosed with a heart condition. And the experience that I had as a young girl in our healthcare system inspired me ultimately to go into nursing and wanting to have this career in public health to help other young kids and other families be able to, survive what could be an otherwise just like so traumatic, devastating diagnosis and process. And so that commitment to health and well-being is what introduced me to this idea of health disparities and illuminating these inequalities within a healthcare system that just doesn't treat all of us the same when we present with the same symptoms or the same challenges. One group of people is taken seriously, another group of people is told to go home or denied pain medication or whatever else. And that just never sat right with me.
Of course, as it shouldn't. And, specifically, you have not only led, but I think you've educated so many of our colleagues about the racial disparities that exist in maternal health. As a nurse, can you just explain this issue to folks tuning in and the work you're doing to address it?
Yes. So the United States leads the developed world in maternal mortality rates, meaning the number of moms that die as a result of childbirth and the full year postpartum. And the reason that the United States leads the industrial world is because of a disparity seen among Black women and Native American women. Black women are 3 to 4 times more likely to die as a result of childbirth in this country compared to white women. And you can control for anything, how much money you make, whether you have an high school degree or college degree or graduate degree, the disparity persists. Whether or not you had healthcare coverage, whether or not you got prenatal care, where geographically you live, if you delivered in a hospital, right? Like you can control for anything and the disparity persists. In my state of Illinois, Black women are 6 times more likely to die. And these are statistics that have been unchanging my entire lifetime. And I'm 33 years old. And so after losing a friend from graduate school who was a PhD level sociologist and gerontologist, she was an epidemiologist actually down at the Centers for Disease Control and Prevention, who had been dedicating her career to ending disparities. She died 3 weeks after giving birth to a beautiful baby girl. And after losing her in 2017, I knew that I had to do something if I were lucky enough to win my election. And so teamed up with Alma Adams to start this caucus. Thank you, Lori, for being in our caucus. And, just recently, we introduced something called the Momnibus Act, which is this huge set of bills, 9 bills to comprehensively address this maternal mortality crisis in the United States. And so our legislation tackles things like mental health and behavioral health issues. So for example, we have had this conversation for a number of years about postpartum depression, right? Everybody's familiar with that. And, a lot of people can even speak to the signs of postpartum depression. But what happens if it goes beyond depression? Right. If there's a suicide ideation or substance use disorder, so many of our communities don't have the dedicated resources to help pregnant women or new moms be able to get treatment and care. We want to be able to fix that. Having diverse health providers, right? Cleaning up the data. There's so many inconsistencies from, across the country, things like that. So that's what we've been working on.
Oh, well, thank you for your leadership on that. I know that whenever I have a question or, even just like the diagnosis is so clear and you've normalized that with all of us. And now it is about, digging in, getting to the root cause of these issues and coming up with thoughtful policy prescriptions. There is just no excuse for our country to be where it is in terms of these disparities and lives are lost as a result, which is just it's what makes this a crisis.
Well, what it's interesting about this is this is an issue that we are able to build bridges with, right? So there are colleagues that represent rural communities that don't share our values on other issues that care about this issue because it impacts their communities and they see it. Republican, Democrat, rural, urban, right? Old, young, men and women, right? Everybody can recognize that our moms should be living to be able to raise their children and, continue forward with their lives.
That's exactly right. That's exactly right. Well, it's been 3 weeks since we passed the Justice and Policing Act, and it was a tremendous moment in the House, but it's important, for all of us to root out racism in all its hiding places and finally implement fair and just policy prescriptions in healthcare, in housing, transportation, education, the workplace, everywhere. Besides your leadership on maternal health for Black women, what other areas are you looking to make an impact on?
Yes. So access to care is a key driver towards the health disparities in maternal health, but just throughout our healthcare system, yielding poor health outcomes for African Americans and people of color in this country. And so Congresswoman Trahan and I had the opportunity to vote and pass a bill, the Patient Protection and Affordable Care Enhancement Act, the first fix to the ACA that we've been able to pass out of the House in 10 years since the law has been around. And within that legislation, we had a provision that I authored to lower out-of-pocket premium costs. So
Yeah.
everybody here is familiar with Obamacare, and we know that oftentimes those plans are expensive. And so if we can expand the access to the tax credits and lower that out-of-pocket payment every month, we could help free up space, those healthcare dollars, for things like prescription drugs or getting a procedure or something like that, which I think is so critical. We talk about lowering prescription drug costs, but we also need to make sure that families have that money even available
Absolutely.
to spend on those prescriptions.
Terrific. And you and I both sit on the Education and Labor Committee, and I know we've talked about this issue before, but would you mind sharing with folks tuning in your thoughts about the importance of building a strong pipeline of Black teachers, of Black doctors and medical professionals that are crucial to closing the gaps that we see in health outcomes for Black Americans?
Yes. So, I am obviously a Black woman, did not grow up with Black teachers.
Yeah.
I didn't have a Black healthcare provider. I had to seek one out as an adult. And, when we think about the pipeline and the workforce, we just don't have the diversity in these critical professions that would allow individuals to have choice in their providers. And, in the education space, it's really a problem because when we think about achievement, we think about that student walks into a classroom and brings their whole lived experience. And if they aren't able to connect with that educator, there's not trust. If there's literally barriers like language barriers or something like that, then it prevents their ability to grow, learn, and succeed. And so that's why it's important for us to be tackling these issues at the congressional level,
Right.
to make sure that all children have the opportunity to be as, successful and, healthy as they can be.
Absolutely. And you can't be what you don't see, right?
That's
And
right.
it's so important for we've heard on the community level. I mean, we've as I'm sure you have, we've attended a lot of listening sessions after George Floyd, but touching on everything. And this is a big one, right? I mean, there are a lot of school districts that they don't have teachers that are reflective of the student body that they teach. And it's something that's long been sort of taken for granted, but it matters, right? It matters in the doctor's office. It matters in our community hospitals and our health centers, and it certainly matters in our school system. So, okay, I know we try to keep these moving and very judicious with our guests' time. But last week I was joined by Congresswoman Karen Bass, Chairwoman Karen Bass, and we discussed how people can sustain this movement well into the future. What advice do you have for people who are looking to sustain this movement for justice? And what are some of the best ways for everyday people, right? Students, moms, activists, who are committed to turning protest into action?
There's so many areas in our own lives that we can examine, from the stores that we frequent, the products that we buy, understanding who owns those establishments or who manufactures those products, to the media that we seek to consume. Right? Are we viewing programs and movies that illustrate a diverse swath of our country? Are we seeking out stories to learn more about the human experience that may not mirror our own experiences? Is our heart open to learning and growing and changing? And I think that if we start there within ourselves and our practices every day, we'll be busy. Right? There's a lot of work that we all can do. I like to challenge myself, to be able to diversify my own patterns.
Yeah.
learn something new and about myself, but also about our community and about the world. And I think that how we spend those dollars, how we spend our time, and what we seek to learn can change our whole perspective.
Absolutely. And making that contagious too, right?
Yes.
I mean, it's Chairwoman Bass gave similar advice, right? I mean, sometimes it can feel daunting to try to impact, what Washington is doing, but the reality is so much is done on the ground in our communities, in our families.
Yes. Small choices.
Yeah, yes, and they're probably one the most impactful because you're just in close proximity to the people that you can influence. So that's terrific. So hey, I have to be respectful of your time, and I'll wrap it up. But just thank you for taking time out of your busy schedule to join me for this discussion. I know that the folks out there really appreciate tuning in and hearing insights on these vitally important issues from people that they don't often get access to. And I'm so grateful for all of your leadership and your friendship over these past 18 months. And of course, everyone out there, thank you for watching. If you have thoughts that you'd like to share with me regarding today's discussion or any other, please visit my website at trahan.house.gov and click to contact me to share your thoughts. I've also included a link to contact me in the comments section as well. I hope you'll stay tuned for future discussions of Being the Change. This is a great conversation series. And for the best way to stay updated on future events, make sure that you're following along here on our Facebook page. Finally, please keep in mind that we are still in the middle of a global pandemic. While Massachusetts has done a great job responding to this crisis, we're still seeing dangerous spikes in cases in a number of states across the country. So we need to make sure that we're continuing to do our part to keep the number of new cases down. Our healthcare heroes and our emergency workers are relying on us to adhere to the basics, right? Wearing a mask, washing our hands, keeping our distance from others in public. So with that, thank you again. Thank you, Lauren. Stay safe and stay healthy, everyone.
Good to see you.
Good to
Bye-bye.
see you. Bye.